So a moment ago, we talked about the death of Alan Thicke. It was quite sudden and unexpected yesterday. He died of a heart attack while playing hockey, in fact, with his son at a relatively young age. He was just 69. Joining us to talk about heart health, something that affects all of us, is Dr. Sabrina Fabi. Dr. Fabi, thanks for being here.
Thanks for having me, Jen.
All right, so heart disease, the #1 cause of death in this country. We've reported that for a long time. Talk to me about what happens when you actually have a heart attack and some of the causes.
Right, so a heart attack is more common in men after the age of 45 and women after the age of 55. In men and women, the most common symptom is chest pain. But women, unfortunately, can sometimes have vaguer symptoms like back pain, shoulder pain, pain along their jaw, as well as just nausea and vomiting, believe it or not. They can also have just shortness of breath without any pain at all.
And so what's the difference between a heart attack and cardiac arrest? Because I think I've been one of those people that have mixed those two together.
Right. A heart attack is when a plaque, basically from cholesterol that over time in one's life basically builds up along the arteries of one's person who's supplying blood to the heart, that blocks that artery and you no longer get oxygen to the heart. That's a heart attack. A cardiac arrest happens when, for whatever reason, you start losing electrical stimulation to the heart. And that's where we have those defibrillator devices all over the place where you can basically apply it and resuscitate someone because you're restoring regular electric current to the heart.
Right, makes sense then why a heart attack is so sudden, because you don't really know if plaque is building up in your arteries. Like most things, I would imagine exercise and diet play a role in your risk for heart attack?
Of course. So the biggest risk factors for a heart attack are high blood pressure, as well as high LDL or bad cholesterol. And then also being obese or being diabetic puts you at risk. But one of the greatest risk factors is smoking. So hopefully people aren't smoking as well. In addition to plaques, you can also have these random spasms. So no plaques along the vessels, but for whatever reason, your artery spasms, that artery that's basically supplying blood to the heart. Now, it's been thought that sometimes drinking a lot of alcohol in men can cause these spasms, but that's another reason why you may get a blood clot or a blood circulation that cuts off blood supply to the heart.
Interesting. All right, so talk to me, obviously exercise, watching your diet, not smoking, some things that people can do. Any other practical steps for people to lower their risk?
Right, so they should see their primary care doctor to make sure that their cholesterol is in check, because sometimes you can genetically be predisposed to have high bad cholesterol, and this bad cholesterol is an indicator of possibly the plaque that's building up inside your arteries that you don't even know about. So you should know this. You should also know your blood pressure, because if you're small and you've always had blood pressure that's 90 over 60, if it increases to 110 over 70, it's already considered high blood pressure for you. And so you should know your numbers. And then obviously quit smoking, make healthier choices like not eating a lot of sugar. This increases overall inflammation in the body that increases your chance, again, for heart disease and other problems.
And maybe doing a little yoga, as we have started our little yoga program here at Fox 5 to make all of us here a little bit healthier. Dr. Fabi, thanks so much for a topic that I think a lot of people are talking about today. Appreciate it.
Thanks, Jen. Have a happy holiday.
You as well.